Hi everyone. Having done many hip surgeries, I would like to everyone what are the types of hip surgeries that people of this elderly age group have when they fall down, they fracture, or they develop severe hip arthritis. Hip arthritis is when the joint is severely worn and it causes a lot of pain, and the ball and the socket of the hip requires you to be replaced so that you can maintain your normal activity. In another scenario, when they fall down or fracture the hip bone, it will break into a piece. The femoral head is therefore not viable and requires to be replaced. So the first option would be a lesser risk surgery, which we call as bipolar hip replacement. We only replace the head of the femur and the rest native cup is sustained, so such that when the patient walks, the ball or the metal ball which is replaced rubs against the socket, and that is therefore enables the person to walk without any pain and mobilize fast. After doing some amount of minimal cycling activity or some strengthening exercises, they will be able to move with a walking frame immediately the day after surgery, and hopefully after a few days with a stick, and within a month ambulate fairly normally. Okay, but if the patient falls down at a much younger age, perhaps 55, 60, 65, then we have an option of replacing the entire ball as well as the cup. Okay, this is what is known as total hip replacement. Total hip replacement also nowadays is very advanced. The wounds are very much smaller, and the chances of patients to recover full range of motion and stability is much better. So when the total hip replacement is done, we will ensure that they have a relatively longer uh, lifespan of the implant, and they can return back to activities much faster uh, after they fall down or they fracture their hip. In severe hip arthritis, total hip replacement is the option. So if you have severe hip pain which is unaddressed for many years, please seek your medical doctor and get it sorted out. Thank you.